So what I wanted to talk to today was about one of the 6 C's that falls under my remit, which is care. And one of the first things I wanted to talk about was what's in good medical practice, which is brought out by the General Medical Council and applies to all doctors. And what that says actually in good medical practice is, and the first line, make the care of your patient your first concern. Everything else follows on from that, and I think that's a really important principle, not just for doctors but also for any healthcare professional, to keep in mind that basic tenet of why are we in medicine, why are we caring for patients. We know from a number of national inquiries that have happened over the last couple of years that care for patients has been substandard in some instances. And part of that has been that people have just taken their job description as being what they need to do at work. And when you're caring for patients, it's important actually that you take more, you look at the patient in terms of what are their needs, what are their individual needs, what are their personal needs in terms of their illness. For me, it's about going the extra mile for patients. It's about thinking, what can I do to improve the care of this patient? What can I do that would make a difference? I think it's important for all of us, not just clinicians, but everybody working in the trust, to think about what can I do in terms of the care of this patient to make it personal, more individualised, and suits the needs of the patient at the time. And I think at the end of the day, the most important thing is putting the patient first.
My name's Louise Payne, I'm Director of Corporate Support at Northamptonshire Healthcare Trust. My C is compassion. For me, compassion begins with having an understanding of an individual's situation or suffering, whether that be a patient, a member of staff, or a carer. But it goes beyond that to showing that you understand and also expressing a desire to alleviate that suffering. And it can be as simple as a touch or asking the question, are you okay? I want to roll out implementation of compassion by gathering examples, by showing how easy it is to deliver compassion in the daily work.
Hello, I'm Bill McFarland, I'm the Trust Finance Director. My C is competence. Competence for all those in caring roles who assess an individual's health and social needs and have the expertise and knowledge to deliver effective care. I'm promoting my C across the organisation by meeting as many staff as possible through regular visits to services, recognising that being competent reaches into all of our professional lives to the benefit of those we care for.
I'm Bronwyn Curtis and I'm the Director of Human Resources. My C is courage. Every week in my job I meet people who have courage. Those people who are driving innovation, trying to do new things in this organisation. Those people who see things that aren't quite right, whether that's in patient care or actually the way that we treat each other. Those people who look at things and say, this needs to be different, this needs to be better, and I'm going to do something about it. Those people who have the courage to speak up about things that are not quite right. And lastly, those people who sit and listen to those who speak up, because that also takes courage. These are the people that I meet and work with every week, and this is where I choose to spend my time, with those people who have the courage to speak up, to listen and to act. For it is these people who will truly create the organisation that we want, an organisation that we can all recommend as a place to work and as a place to receive care.
I'm Julie Shepherd, I'm the Interim Director of Nursing Quality for Northamptonshire Healthcare Trust. My 6 C is commitment. Commitment means to me, as a nurse, going the extra mile and actually making a difference for patients. 30 years on, this still stands true to me. The 6 C's are a vehicle for delivering high quality standards within Northamptonshire Healthcare Trust. I have been working with school nurses this week on what the 6 C's means to them. We looked at care And care actually meant to them, that's what they came into nursing for, was actually to make a difference and care for patients. And I think that's the same of all professionals, not just nurses. We looked at each of the 6 C's, and one of the groups came up with a fantastic definition of what commitment meant to them. It was a personal pledge to invest time, energy, and remain dedicated and loyal in completing the journey. And I think we all strive every day to achieve this for our patients.
I'm Richard McKendrick, I'm the Trust's Chief Operating Officer. My 6C as Chief Operating Officer is communication. Communication is key to a good workplace, it's key to a good caring environment, and it's central to everything that we do. It's about listening to people, talking to people, taking on board what they say, and being able to communicate to your team, your manager, and to the carers and service users who we serve. Communication is central to caring relationships, and there's nothing more important than our staff being able to listen to our patients and truly listen to the patient's story. The other central area for me is about being able to listen to each other and being able to talk and communicate. Being able to talk to your line manager and to your colleagues to build that team environment where communication is so central.
My name's Shawn Choi, I'm Deputy Director of Children's Services. The 6 C's for me are about a set of values, attributes and behaviours that really come together to demonstrate how we provide good quality care. They're very relevant to nursing, but actually equally I think they're very relevant to all of our health professional groups across the organisation, managers included, which I'm now one. I think that they're not, although we look at them independently and we know there's 6 and we can name them all, I don't think they exist in isolation and that they are very interlinked and it's quite difficult to separate them out. I think some examples of when I see the 6 C's in operation are real courage that we see within our health professionals that are working within child protection, where actually they have to use the attributes of their competence, their communication, to identify children who may be in need of protection or in need of safeguarding. They then need to use the attribute of communication and of courage to take those instances forwards to make sure that children are protected. They also have to use compassion in thinking about actually what is it like for this child in this situation at this time that make them take those further actions to ensure that we are safeguarding children. So in those instances, our health visitors, our school nurses and other nurses working in that field use all of the 6 C's in a daily way. I think also with the 6 C's, it's important to think about when things don't always go according to plan, when we do have complaints, when we do have service users that are not satisfied with our service, then it's often an element of the 6 C's that has gone wrong for people, where we haven't communicated well, where we might not have quite got the care right, where we haven't been compassionate. And that's important for us to think about actually in our daily work.
Hello, my name's Carly Oakenfull. I'm the lead occupational therapist in forensic and rehab. I have an understanding of the 6 C's that are quite personal, I guess. What I see by them is that they give a way of describing some personal competencies and qualities, and that you can use that to actually describe what your work is about. It takes the focus away from some of the targets of financial targets and clinical outcomes, but puts a balance and more of a focus on the service user and what your work actually means to you. How I implement them in my work, in many ways, but there's been a particular initiative of late that's been really important and that's taken some time to implement. Some of the core and key attributes of those 6 C's actually are embedded in one of the models of care that we use now, which is employment support. Employment hasn't normally been seen as a recovery outcome or a recovery goal for people, but it's one of the most important things, and evidence has shown that without those recovery goals, it's quite difficult for people to actually maintain that recovery and well-being post-discharge. One of the things that we've done is been able to include employment support as part of our service delivery. We now have an employment specialist who goes towards the other end of our care pathway and actually is able to find people jobs once they're leaving hospital. Our vocational pathway now enables people to gain MVQs, get vocational skills throughout their time here.
I'm Rita Reeves and I'm the modern matron for the community hospital beds. 6Cs has been an opportunity for myself and the teams that I support to actually be supported in taking a deep breath and kind of thinking, what have we done right? And also the opportunity to be open and honest about what we know we need to improve upon. Importantly, the 6Cs is relevant to all staff. Everybody's got responsibility in terms of getting things right. In the areas that I support, one of the ways that we've looked at in how the 6Cs can actually influence on improving our practice is through our interprofessional working and how we can actually challenge each other in terms of clarity on our roles, who's responsible for what in terms of effective and timely discharge planning for our patients. It made us kind of examine our processes, be honest about them, particularly on an interprofessional basis with our external partners in terms of really drilling down what is it that we're not getting quite right, where are our delays, so that we can actually expose the gaps in the services really and try and get that right. It's also allowed us to look at how we can develop roles further, and we have developed competence in nurse and therapist-led discharge. Another consideration that we've given is how we actually communicate with our patients and their families, and we have actually changed some of the process now so that we try to engage with our families earlier in terms of discharge planning, and this means then that relatives and also then the patient can be better informed of risks early on around discharge planning, so that they're making more informed choices around that.
My name is Priscilla Brown and I am one of the carer governors for the Trust. In the 6 C's of nursing, care is the first C. The triangle of care is the knowledge carers have to support the service users. Care is to be recognised for their knowledge with supporting the service user. Compassion. Carers have a voice to be heard and feelings. Communication. To listen, help and inform carers. Courage. To set time aside, listen and don't be afraid to ask. Commitment. To work hand in hand with all carers. The triangle of care is bringing the professional, the service user and the carer into one triangle of care. It's giving the 6 C's and the triangle of care working side by side.
I'm Christopher Thurston, known as Chris. I'm a healthcare assistant employed on Meadowbank Rehabilitation Ward, which is part of the forensic facility embodied in Berrywood Psychiatric Hospital in Northampton. It's my duty, amongst other people, to look after the more basic requirements of our patients, all those duties below those that are embodied in qualified staff nurses in terms of clinical medication and assessments and that sort of thing. They are watchwords that I think govern, or should govern, the way we treat everybody, particularly in a setting such as this where lives are a little more fragile than might be experienced in the big wide world. But they are watchwords that epitomise a caring society. Let's hope they continue to be used in such a fashion by more people, hopefully. Broadly, by trying to deal with people as I'd like people to deal with me, in a compassionate, caring and professional fashion. It has to do with the fact, I think, in this environment, more particularly than a lot of others, that it's everybody's different, and the conditions vary very widely from person to person and from day to day, and it behoves us to adopt as adaptable an approach to the job as possible, and that covers all those 6 C's in terms of getting the most out of myself and getting the most out of people and helping them to get where they'd like to be, if it's at all possible.
My name is Paul Burton. I'm chairman of the Trust, and I would like to talk about care. The reason I choose care is because it applies to all of us in different ways across the Trust. For the board and for management, it's about caring for the health of the Trust, by which I mean ensuring that the finances are right, the culture is right, and that we encourage and develop our staff. And this will allow us as a Trust then to provide the best possible care to our clients and our patients, and of course then to their carers in turn, because they are equally important as part of the services that we provide.
Hello, I'm Hilary, Chief Executive of Northamptonshire Healthcare Foundation Trust. The NHS has been under an incredible amount of scrutiny over recent years, particularly challenged around its ability to deliver quality care. The 6 C's give us a tremendous opportunity to think about how we can rise to that challenge within the organisation. We need to combine them with our trust values and think about the shared purpose they offer to give us the absolute opportunity to deliver our priority, which is compassionate care. I want you to think about the 6 C's on an individual level, a team level and an organisational level, and really think about challenging each other about delivering those behaviours and those 6 C's on a day-to-day basis. They give us a real opportunity, an opportunity for you to take to think about putting patients at the centre of our care, and I hope that you will take the collective action that's necessary and embrace them, which I think is really what it's about today.